Welcome back to my channel. This is Nasu Mwangi with Fight for Kidneys. I'm so happy to join you again today as we explore more about kidney disease, about dialysis, and what to expect. But before we start, I would like to say thank you to those people who have been my regular viewers and those of you who have subscribed. It's very important to subscribe, like, so that we can educate a lot of our friends, families, families, friends, co-workers, and mostly those people we care so much about. This channel was born out of love, about somebody who has passion about kidney disease, and I feel that the more we talk about it, the more we'll bring awareness. So, before we start, let's review at our last video that we did last week. In my last video, I talked to you about choosing dialysis, about the care team. So once you choose the care team, whatever the modality you choose, either you choose peritoneal dialysis or you choose hemodialysis, either at in-center or at the clinic, you find there are some people, you find that you have care team who are involved in your daily care or your daily treatment. They help you walk through. They are the people, sometimes you call them on the phone and they answer. So my question is, if you are that person who listened to me, and you have somebody that you know that is in dialysis, either at home or in center, have you asked them whether they have met their care team? Who is their care team that have impressed them most? Have they said thank you? And if they have not, could you please encourage them to meet and get to know their care team? That nurse they connect with, that doctor they connect with, because those people are part of their life and those are the people who walk this journey with them. So today, we'll be looking at things that you should expect or things to expect. If you are new to dialysis and you have just walked in, you have met your care team, because I think by this time you have met your care team, or if you have not met your care team and today is your first day, or it's in dialysis, either at home, you're going through the training to do it at home, or you are doing it in center. So the first thing that they'll do, of course, they introduce themselves, and then when you walk in, they'll do all the paperwork. There are a lot of paperwork involved on your first day of treatment. But let's say now you have done all that and now you're starting your treatment. The first thing you walk in, you find somebody who greets you, either a reception or a secretary, depending on which country you are in. And that person then will bring you to the treatment floor, or the nurse will bring you to the treatment floor. And the first thing they do is check your weight. So you get weighed every time you go to dialysis, when you walk in and when you walk out. And weight is something very, very sensitive to, especially women. We don't want to be weighed where everybody can see, or where, on the scale. Nobody want to step on the scale where somebody else is seeing our weight. But it's very important to get weighed or get weight in dialysis. What does weight tell us? So when you start dialysis and when you're in dialysis or your loved one is in dialysis, you hear them say something about EW or EDW, that means estimated dry weight. That means, so the doctor will come in and they will decide which weight, after we have taken every excessive fluid that you have retained, what's your actual weight. Say for instance, I'm walking into dialysis today and I weigh 45 kgs. That's not what I weigh, but I'm just giving a number. I weigh 45 kgs. And the doctor said, let's try take 2 kilos. So 2 kilograms equals to 2,000 mLs or 2 liters. So by the time I finish dialysis, they'll take 2 kilograms, So by the time I leave, I'll be 43. And the doctor will say, hey, if you go, this is the weight we want you to be. You want to watch out that you don't drink too much between treatments, because this is your weight. We are not putting too much. You're not drying off. We are not drying you, but this is the weight that you should be. If you come to dialysis, you should not gain that much, you know. And then they'll be monitoring that dry weight. So that's where the weights come in, to help the nurse and the doctors decide how much do they need to take off, or how much have you gained between treatments and between treatments. When you go to treatment and when you're done with treatments, that's the weight in between. And then the other thing they'll check is the nurse will do assessment. They'll do they'll listen to your heart. They'll check if you have gained any fluids in your legs, you know, in your body, in your lungs, you know, any fluids that is retained. They'll ask you a couple of questions. Have you had any problems since your last treatment? Say, for instance, you ate something and you had a lot of diarrhea, so you lost a lot of water. So that will come into account. How much do we really need to take? Are you feeling okay today? So they'll ask you multiple questions. Or if you went to the doctor, what took you to the doctor? Most people will say, hey, I had a headache or something else was happening, and the nurse will ask more questions. After that, they'll also do, they'll check your blood pressure, they'll check your temperature, they will check your respirations, and they will listen to your pulse, that's your heart rate. And then that one can be done by a nurse, or it can be done by a patient technician, or somebody who else is helping, who is trained to help a nurse. And this is the same thing you do if you're doing dialysis at home. You have to monitor all those things, and you have to answer those questions. You know the questions they'll be asking. And then after that, say probably you have before you go, now after you have done all that, or before you go to get your vital signs, they will you're expected to wash your access. That means if you have you have to wash your hands the minute you walk into dialysis. Let me just say that you have to wash your hands with soap and water, not the hand sanitizer. It's the soap and water, and wash your hands well between fingers. Make sure your fingers are short, and for all of you, not just for ladies. And then they will do, if you have a fistula or a graft that we talked about, that access you have on your arm, they'll ask you to wash it with soap and water. That's you doing it. If you can't do it, somebody will help you wash it, because probably you are not capable of doing it. Somebody will help you do all the washing. And then now you sit in that chair, and that's where they will now do, you know, like they have to get a sitting blood pressure and a starting blood pressure. So that to make sure, you know, see whether there's any difference. And then they will sit, get you comfortable in your chair, and then they also have now to start accessing your access. They have the nurse or the technician will wash your access again. And then if it's a catheter, they wash, change the dressings, you know, and they are still washing hands. There are a lot of changes. You know, you have to make sure all sterile technique is, aseptic technique is maintained. And once it's clean, the access is clean, if they're putting the needles or they're accessing your catheter, then there's some bloods that need to be drawn. And we are talking this mostly for hemodialysis, where there's blood. If it's peritoneal, it's a different case. There's no labs you're drawing from, unless they need to check if you have some infection. They might ask for that fluid. But other than that, that one is just cleaning and connecting. So your doctor may probably have asked for some labs that we'll discuss what labs most of the time you get. So they will draw those labs, and then they will start your treatment and connect you to your dialysis treatment. So that's when you walk. So, and your dialysis treatment might run from between 3-4 hours, depending on how much the doctor has prescribed you. And that is individualized. It's not like a standard for everybody. Some people might need 6-hour dialysis. Some people might need 3 hours. Others might need 4 or 5. And then throughout, while you are doing dialysis. So you'll be there for 4 hours. So somebody will be checking you. And even if you're doing it at home, you have to do the same thing. You have to check your blood pressure every 4 minutes, every 30 minutes. I'm sorry about that. Every 30 minutes. And this time you're checking how much fruits you have taken, you have removed, how much your blood pressure, your heart rate, and then you also be checking about how is the machine learning? Is everything learning as it's supposed to? You know, is the machine working as it's supposed to? And if you're working in somebody else is helping you, they'll make sure that they can see your access, that it's not covered, that the needles are still in place, because that is very important. You know, they'll do all those safety checks throughout your treatments. And then when you're done, they'll do the vital signs. Listen, the nurse will do another assessment, ask you, how did your dialysis go? Did you feel any different? Did you have any concerns? They'll also listen to, you know, check your feet, and then they'll also make sure your access is not bleeding. Once, you know, they're done with the treatment, they'll make sure they have removed the needles, it's secured, they have watched it, put pressure on it, that it does not bleed after those needles have been taken out. So it's a process. It takes about, from the minute you finish dialysis to the minute you walk out, it could be about 30-40 minutes, you know, and that's just to make sure your treatment is okay and you're fine to go home or to be driven home. And for the same thing, if you're doing it home, you still have to make sure once you take it, you're not just lashing. You take the needles and you put the tape there and you're like, oh, here I go to the kitchen to make dinner for my family. You still have to make sure that the bleeding has stopped, and that when you walk, you move your arm, that bleeding will not open again. And so let's check about the labs that you need. So when you're in dialysis, there are some labs that need to be done. Some of them are done on a monthly basis, and some are done on a weekly basis. So, and what do these labs mean? Most people will probably, you walk in and it's either you're doing hemodialysis at home or you are doing it at center. You still need those labs. And most people will be like, what do I do? Probably they just get the tubes and draw the tubes, and they don't know what those labs mean. It's small tubes, not a lot of, some of them it's like just a tiny amount of blood, like 3 ml, 2 ml. So, and that get drawn on a weekly basis, on a monthly basis. And sometimes the doctor might ask for some labs as needed. And your care team will tell you, or they'll call you if you're doing it home and say, hey, we need some extra labs and this tube look like this, or they'll ask you to come for that extra tube to get it. Or some places you have to go to those clinics. If you're doing peritoneal dialysis, you have to go to the clinic to get those labs done. So what are those labs? So there's one lab that measures the hemoglobin, that's your red blood cells. And that's overall making sure your heart health. Okay, you need enough hemoglobins to keep you going, you know, to give you for the oxygen to circulate in your body. So that blood is important. You don't want to be anemic. And we know people, when they are in dialysis, they become anemic, and because either their kidney is it's not producing it's a hormone that boosts the production of red blood cells. And that's why most people in dialysis, they need that. They might need a booster for the hemoglobin. You also need to check your potassium, because your kidney is not working. It's not getting rid of all that extra nutrients. The nutrients we take, they're not getting excreted in our body because the kidney is not functioning. And potassium makes sure it measures your overall heart health. You don't want to have high potassium, because that one can give you a cardiac arrest. So they also measure the nutrition value. Are you taking enough nutrients? Are you low or high? It has to be there in a normal range. Albumin also measures your nutrition, and also that helps to make sure your healing process. You know, if albumin is important for our healing, for our body to heal. You also check the phosphorus. That's very, very important. It's that lab that checks the phosphorus, and the phosphorus are for the bone and nutrients. So we know, again, because our kidneys are not functioning, the phosphorus can be in your body and then accumulate too much because it's not getting rid, the kidney is not working, and the kidney is not able to get rid of that extra phosphorus that is staying in your body. They also check for potassium, that's for your heart health. We don't want it to be high, and also for your bone health. So there are those labs they check, and then they check parathyroid, that's for your heart and bone. And this is because your kidney is not functioning. Your kidney, like I said, it's a small tiny organ, 2 of them, and most of people don't even know how much work this kidney do as far as you are maintaining your nutrients in the body, the production, the regulations of your body. You know, it does a lot of work, but most people don't understand. And that's why I'm here to talk about the kidney health and overall, you know, what to expect if your kidneys have failed. The other thing you hear is about adequacy. That's the lab that tells you overall how much is your dialysis. Are you getting enough dialysis? And if you're not getting enough dialysis, the doctor might look into other things like increasing your time, making sure your access is fine, making sure, you know, you're not clotting, you know, the dialysis is not clotting. And this, both of them, is either you're doing hemodialysis at home or you are doing it in center. So now that we have talked about the labs and what to expect. Now you are new to dialysis or you have been in dialysis. You need to know your medications. There are medications that as a dialysis patient or that person, their kidneys have failed, and probably you might not have started dialysis. Your doctor might say, depending on where you are, you might be needing some of these medications. So it's very important for you who in dialysis, who have kidney failure, and who, or you have a loved one who their kidneys are failed or they're not functioning as they are supposed to, that you need to talk to them and making sure they're taking these medications because they're important. They're very important, and taking them on a regular basis and talking with their primary care doctors about the medication that they have been prescribed while in dialysis or by their nephrologist. So the one drug that is common all over the world is iron. We know our kidneys are not functioning, and the iron help with the hemoglobin and stimulate the production. The iron help the stimulator of the production of the iron. You need that because most of the time your hemoglobin goes down, either because your kidney is not functioning. Also, when you're in dialysis, you lose blood here and there. You know, there's a little blood that is not in between, like when that dialyzed, you know, those things happen. Then you need the vitamin D. This helps to correct vitamin D. It's a deficiency that happen also with people who have kidney disease. So that's like a supplement to help that vitamin D that your kidneys is not helping, you know. Then you hear about phosphate binders. And this is so important, and I would like everybody, because some of the drugs you get them at either at dialysis, but the phosphate binders, these ones, you have to be in control of it. You have to make sure you are taking it. So the kidneys are not functioning, so, and you're consuming all this food, and we know that's why it's very important to read your food labels to make sure, do you have, what are the content of the phosphorus in food? We know a lot of processed foods have a lot of phosphorus, so it's very important to make sure you understand about the phosphorus. So the phosphate binders, it's like a sponge. That's how the easiest way to put it. So you have all this, you consume foods with phosphorus, and because your kidney is not functioning, it cannot get rid of that phosphorus. So this sponge, you take it with every time you take a meal, with snacks, every time you eat and you take snacks, you have to consume that phosphate binder. And you hear about it, most people will call it, how have you taken your binders? They'll tell you, you need to take your binders. And the reason why it's that help, the phosphate binder, is like a sponge. It absorbs that, it helps absorb those, that extra phosphorus in your body. Then there's heparin. You use heparin in dialysis, either at home or in center, and this is just to help prevent your blood from clotting. You know, the blood is going through the circuit to the dialyzer, the external kidney or your artificial kidney, and you don't want that to clot, because if you clot, you lose a lot of blood. You also lose blood, and then if you clot, yeah, mostly you lose a lot of blood if that system clot. Or then it can make your access clot. So either it's the catheter, if your blood is too thick, and then it will make your catheter clot or your access clot. That's why you get those things given to keep your, it doesn't it doesn't have a long life, but still it's when the blood is coming out to prevent that clotting so you don't lose the blood. And I say the heparin, that's common one. Most places they use, if you're listening from another country, I'll say a blood thinner that you are given in dialysis, because I don't want to say name, and that's a common name here, but in another country they might call it a different name. But just ask that blood thinner medicine that you get, it's given IV intravenously. That is to prevent clotting. And also ask those questions, those medication that you get given in dialysis, or some of them you might be taking at home. You also have, you hear Procreate, Epogen, RNS. That's another that helps create more red blood cells. So I know for sure Procreate, Epogen, it's a common word all over the world. But you might go to other country and they call it a different name. But that's just another drug that help boost your red blood cells. And then you're also prescribed like kidney vitamins. This one you don't get it in dialysis, you mostly get it at home. And I'm talking about this medication because either form of dialysis you're doing, most of them you're gonna be taking the phosphate binders, the kidney vitamins, the iron, all those things. You'll be taking either way if you have kidney failure. So depending on how your body is doing, there's some people who have kidney failure and their hemoglobin stays fine. They don't even need all these things. So, and you have some people who have naturally, they have a thin blood, like their blood doesn't clot, or they have other like clotting factors that, their blood doesn't clot. Then they say that. So the vitamins, this one, they are given just to help, stimulate, it's like a replenish of what your body is now making. So you need those vitamins, and you can buy them anywhere. You can buy them at the store. Some of them can be prescribed depending on the dose that you need. So I hope today you understand about those things. I try to speak a little bit fast so that we can cover this. And the other one is, I forgot about blood pressure medicine. Yeah, even if you're in dialysis, we know this is sometimes it's so confusing. People are like, blood pressure, your kidneys, this one, help regulate your blood pressure. And if it's not functioning, your blood pressure might be off the skyrocketing. So you still have to take some blood pressure medicines. And it's very important to understand your blood pressure. So do you need to take it before? How is your blood pressure? Is it way high that you have to take it whether you are going to dialysis or not? There are some people that their blood pressure drop, and the day that they go to dialysis, they might not take it. Or they are going to dialysis, they might take it later. So you have to understand how your blood pressure works, and discuss with your doctor about your blood pressure medicine. But it's very, very important to make sure people are taking blood pressure medicine. Most people are afraid, and I speak to people and they're afraid. They're like, I don't want to take my blood pressure. I'm afraid I come to dialysis and my blood pressure might drop so low. And I ask them, please talk to us. Let us know your blood pressure. Let us know. Talk to, discuss those things with us, because you don't want your blood pressure to be high, because that it can damage your heart. And also you can get a stroke, and you do not want to get a stroke. We know how, what the stroke itself, the impact of having a stroke. So I hope you understand those medication as a person who is in dialysis, or if you have a loved one. So for this video or for this channel, I'm not just talking to people who are actually in dialysis. I'm also talking to you who have a loved one who is in dialysis, or that person who is a care team who take care of a patient. Because if you're seeing this patient, you can talk to them. And to me, it's that one word you get. Like every day I leave this channel, I want you to remember that 3 people, 1 person out of 3 people is at risk for kidney disease. So if you can remember that one and talk about it, that help fight kidney disease. Go to your government, talk about it. And if today you remember about that, just because you're in dialysis does not mean that you do not need to take your blood pressure medicine. You still need to take your blood pressure medicine and ask that person, or remember, hey, yes, that lady said I need to take blood pressure medicine, or about phosphate binders. And for men, please take your phosphate binders if you're in dialysis. And I'm sorry to say it, but I'll throw it out there. If you're in dialysis or your kidneys have failed, you need to take your phosphate binders, because if your phosphorus is too high, there are some things that might happen to your manhood, and you do not want that to happen. That's essential to take your phosphorus binders. And for everybody, but I try to tell men, please take it. Anyway, thank you so much for joining me again today. Please subscribe, please press the like button, the ring button, let somebody else know about it. And I appreciate all of you for all the support, for those people who have emailed me and telling me that I need to do some more in my language. I'll work on it, and I'll continue doing these videos to encourage everyone to know that just because you are in dialysis or your kidneys have failed, that's not the end of it. You can live a thriving life even with kidney disease, and we are here to work together and fight for it. Thank you so much.